Hi everybody, Nurse Revay here. This is one of my favorite microneedling patients. He has come such a long way since we first started his treatments. This is his fourth microneedling. Today we did a subcision with Sculptra. I think anytime you have acne, and depending on the type of scarring, it really does take a methodical approach, and Dr. Emer has kind of created that for him. So tending to all the different types of scars because they're not created equal. I can't wait to show his results with everybody because they are absolutely amazing. So last time we did his microneedling, I had to give the camera a disclaimer because we got really deep. It was very aggressive microneedling treatments. They don't always have to be that way, but with what we were trying to achieve, and he allowed me to have, or for at least him to have the downtime, we were able to go very aggressive and we had a beautiful result from our last treatment. So today we are using PRP, which is our platelet-rich plasma. We're going to do some more microneedling and see what we get today. Good thing it's our own, right? So microneedling is something that we really can cater to every single skin type, every single skin condition. He does get a lot bloodier than most of the patients that we see, and that's not because of something that he's taking, it's because of how aggressive we're treating him, and it doesn't necessarily have to be this way. But with him, he's had very severe acne scarring, so we are trying to be very aggressive in our approach to trying to combat it. Even the most aggressive treatments, I mean, and foreheads are some of the more spicy areas, it's really not that painful. I mean, Michael, what do you think as far as the pain level? And be honest, like.
Yeah, it's like maybe a 2 out of 5. I mean, it's not really like anything painful. I'm used to it, I guess. I'm like a trooper. But, I mean, pain, beauty is pain, right? Or pain is beauty. I don't know how it goes, but, you know, you want to be beautiful, so you got to do what you got to do. So.
Well, and people that have, like, severe acne scarring, it's something they've lived with their whole life. So, you know, they're just as tired of living with it. And even though we'll never be able to correct it fully, we can absolutely improve the appearance of the scarring. And like I said, I can't wait to share his results because he's had amazing, amazing results. And we still have a long way to go, but it's a process. It didn't take him overnight to create these scars, and they're not going to go away overnight. Collagen building does take time, so that's why using things like Sculptra in combination with what we're doing is a great combination because it makes us build our own collagen. So with him, I'm going to do multiple depths. He has a little more severe scarring in the temples, so I'm going to go deep and then I'll go a little more superficial. So for those that are just tuning in, we are doing microneedling with PRP, but this is a very aggressive treatment. I think everybody needs to understand that. Not always are we treating like this. Not everybody has a downtime. What was your downtime, Michael, after our last one?
Honestly, it was only like 2 days.
What?
Yeah, it was only 2 days.
We went so aggressive.
Yeah. It was only 2 days. It was crazy.
Oh my gosh.
Yeah.
And that's one of the other things I love about microneedling is how fast you rebound. The first 24 hours, you lose at least 50% of your redness. By day 3, your skin starts to slough, kind of like you've used a little bit too much Retin-A, but it's very tolerable. So with this treatment, we can do stem cells, which is a great option. Dr. Emer has a special stem cell that's created just for him. We also can use our PRP, which is our platelet-rich plasma. It's all of our own natural growth factors, so you cannot have any type of reaction to it. You can use an HA, a hyaluronic acid, something that just helps plump the cells. It's not going to be as good, but it's still a good option. So it's really nice that with microneedling you can combine so many different things depending on what you want for your results. So before today, he had, well actually this is his 4th microneedling treatment with me, but today we did a subcision and Sculptra. So doctor put Sculptra in, and Sculptra is actually different than all of your other fillers because it makes you build your own collagen. So it's great when used for a more natural effect, not that instant lift or instant improvement, but a longer lasting one. And then he also had a subcision, and a subcision is where we can take a little tiny needle, and depending on the acne scar, if it's bound or it's kind of tied down, you can use a needle to break that up. Kind of like, he had like 4 or 5 of them, a couple on the other cheek, and we just put the needle in there and break up that band, and it pops the area back out so it looks fuller. So when you're treating acne scars, really a multi-dimensional approach is the only way to go. There is no one way to treat acne. And if you continue to just do one thing, you're going to limit your results. So one of the things that Dr. Emer is best at is creating these treatment plans, not just for the problem that we're trying to fix, but maintenance. So we're going to maintain that improvement. If he was still having acne breakouts, then he wouldn't be getting the great results. So one, you want to control the breakout, and then you want to start tending to the acne scar itself. So I don't have to go aggressive on his chin, as you can see. He doesn't have anything going on there. So I can kind of choose to go a little bit lighter there, maybe more superficial for pore size, pigmentation, and redness. And then when I go back to the cheeks, I can do a little bit deeper, a little more aggressive, and then try working on remodeling those scars. You doing okay?
Oh yeah, I'm good.
So after you get off the forehead, it really is pretty painless. You have some areas that feel scratchy, but here we'll go a little more aggressive. So for my squeamish viewers, you'll have to look away. After our last one, I had a few comments. Not for everybody to watch, but the realness of acne scarring is a problem, and it's nice that we have ways to improve it now, and improve it in a way where you don't have to live with scars like this for your whole life. Nice too, we can come down to the jawline and get some of this. Not that you see it all the time if you're looking straight at them, but during our treatments, we don't want to leave this because then that would make it more noticeable. I love using PRP. Makes you heal faster, better results, no possibility of a reaction. And the blood draw is easy, right?
Yeah.
Helps when I get a lot of practice. We use PRP a lot here at Dr. Emer's office. It has a lot of different applications. So depending on what we're trying to rejuvenate, we are able to kind of use that PRP. You can use it for hair, to help your hair grow. We mix it with a stem cell that's created for Dr. Emer, specifically for him. That is a hair stimulating growth factor, so that's great. You can use it for rejuvenation, vaginal rejuvenation, penile rejuvenation. So it definitely, PRP has multi-functions. So where his acne is the worst, we're really going to go more aggressive. I mean, our last treatment, we had such great results. He had a subcision here, so this is the other thing. When you do have a subcision, you will have a little tiny bruise It's deep. Those bands are tied down. So before he had it, it really looks like this, like it's very, very deep. So when we break it up and it pops up, you get a lot of redness, that erythema on top. But that will go away. That will actually probably last longer than the microneedling. What are you thinking, Michael?
I'm thinking I'm gonna get amazing results, and I'm
You
excited.
have so far.
Yeah, I mean, a week from today, I'm just excited to see my before and after. So, yeah, the results were amazing from the last visit. So,
Yes.
with the subcision and the sculptra, it's just gonna be even better. And then the PRP as well.
It's great. All right, you guys. So we have a couple of these today. I'll be back later with another treatment, but thanks for tuning in.